All right, so I'm going to be giving my inhaled drug administration. So currently I'm in the medication room, so I would perform hand hygiene, and I have my MAR sheet in front of me, and as I'm getting my medication out, I'm making sure that it's the right patient, it's the right medication, the right dose, the right route, and also the right time. So I'm just verifying all of that. And then I'm also discussing the nursing considerations indicated on the Skills Lab medication administration guidelines. So once I have all that, and I have all my meds, I'm going to go to my patient's room. So as I'm going in, I'm going to perform hand hygiene. I'm going to pull back the privacy curtain. I'm going to introduce myself. Hi, I'm Emily. I'm going to be your nurse today. I'm going to be giving you your inhaled medication, and I'm going to ask them for their name and date of birth. So I'm going to ask for the name, date of birth, and then I'm also going to compare that to their wristbands on here, and I'm also going to compare it to my MAR sheet to make sure I have the right patient. And I'm also going to scan my medication, so I'm going to scan that since I did not do that in the med room, and I'm also going to ask my patient if they have any allergies and make sure that that corresponds to my MAR sheet. And then I'm going to raise the head of the bed up, and while I'm doing that, I'm going to explain to my patient what medication that we're giving them and why they're getting it, and just answering any questions that they have for that. So I'm going to raise the bed to high Fowler's position. Get them all the way up. All right. And so let's see. They're in high Fowler's position, and then I'm going to explain to them so what I'm going to be doing. So because this is going to be a drug without a spacer, I'm going to tell them that I'm going to shake it first, and then I'm going to have them exhale all their air out, and I'm going to put the mouthpiece near their mouth. I'm going to tell them to take a slow inhale, and as they do that, I'm going to administer one dose, and when they're pull it away, and then once they're done with their inhale, I'm going to tell them to hold it for 10 seconds, and then they're going to exhale out through either pursed lips or through their nose. So I would explain all that to my patient, and then have them do it, and then watch them. And if I was doing it with a spacer, the only difference is after they exhale out, then I would give the mouthpiece to their mouth, and I would give them the dose as they inhale, and I would tell them to either inhale slowly for 5 seconds or take 3 to 5 short breaths until they get all the medication out of the spacer. So we would do that, and then if I need to give them a second dose or another medication that needs to be inhaled, I would wait at least 1 minute. And if I needed to give them any bronchodilators, I would give those first before I gave them the other medications that needed to be inhaled. And if this was a steroid medication that I gave them, I would also have them rinse their mouth afterwards. So I would administer my medication. I'm going to make sure my patient is comfortable. If they have any questions for me, if they need their possessions, they need to go to the bathroom and all that. I'm going to take away the privacy curtain. And I'm going to, if my patient's all settled, I'm going to wash my hands, and then I'm going to go document in my MAR report.